Hey guys, Dr. Kilfoil here with Podiatry Explained. Today we have a very special guest, Dr. June Reyes, DPT, right here in Baldwin, New York. He literally is across the street from my office. And here, as you guys know, Dr. Jillian Irwin. So today we're going to be talking about fall prevention in the elderly. One of the most common causes of mortality and morbidity in the United States result from falls. So we want to review some of the evidence, we want to review some of the treatments and other considerations, especially having to do with the feet and podiatry, so you and your family can prevent falling. It's been very well understood that after a fall, the likelihood of somebody dying, unfortunately, is very high. When you have a 90-year-old mom, a 90-year-old dad, they fall, they break their hip, it's usually a sign that something bad is going to happen in the next few years. But if they do survive the fall, or if they do say to somebody that I'm afraid of falling, then it's time for you as a doctor or a family member to intervene. And I want to tell you guys about how we intervene when somebody says that. So when it comes to diagnosis of it, a lot of times it's a patient who approaches me, or a patient comes to the office for either a routine checkup or something like that. And I usually ask them, hey, anything new in the medical history since the last time we saw you? Any new medicines, dosages, hospital visits, falls, alien abductions, psychiatric admissions, coronaviruses, or surgeries? And either they didn't hear me or stopped listening, so they didn't miss the alien abductions part, or they'll mention to me, sometimes this happens, I swear, and you should definitely ask, I had a fall last week, or I had a fall last month, or you see the giant black eye and the giant bruise on their head, and you're like, what happened? And they say, I fell. And it's your job at that point to intervene and do something. So what I do is I ask them, are you confident that you're not going to fall again? And I also take a good history and understand what could they possibly have, with them, their past medical history, that led to their situation. When you have a patient who has had a fall, Dr. Irwin, what kind of patients typically do you see?
So they tend to be older patients with a lot of comorbidities, and when you mention that, one of the first things we think of is polypharmacy. They're on a lot of medications. So I start asking, when is the last time you saw your primary care doctor? Who's monitoring the medication? Make sure that they're not on too many medications. They're not getting gabapentin from this doctor, but then also gabapentin from this other doctor. Now they're combining and they're getting dizzy and falling down, for example.
Right, polypharmacy, very big one.
Not for patients or combination, not just the other medication, blood pressure medication. Sometimes it would take pain medication combined, and most of those medications, they have the side effects of drowsiness. So when they wake up in the morning, or they need to use the bathroom, that's when they usually fall going to the bathroom inside the house. So a combination like falling medication, that's what.
The other ones that I like to mention are visual problems, anybody who has any kind of degree of blindness and cataracts, diabetic polyneuropathy, where they don't feel their feet, they don't have the proprioceptive capabilities that they used to have, even diuretic use, water pills. So somebody has to get up in the middle of the night once or twice a night because they're taking water pills. If their environment is not suitable or it's treacherous, they're likely to get tripped up and fall. That is a danger. And as a family member, make sure that your mom and dad keep their path, at least from their bed to their bathroom, without clutter. Very, very important. So a lot of times when I see these patients, their son or their daughter's, right next to them, and I'm talking directly to them. I'm not talking to the 90-year-old. Unless not many 90-year-olds are watching these YouTube videos, I would guess. So this is going out to those guys. So make sure they're not taking too much medicine. Make sure that they're hydrated. Also take a look at their feet. Their feet are going to be kind of important when it comes to not tripping. Shoe gear. Shoe gear is actually something that is kind of controversial in this aspect. What would you think would be the right kind of shoe gear to recommend to your mom or dad? Put it down in your comments what your prediction is that Dr. Irwin's going to say. All right, so what do you think?
Well, normally, if we're just talking about going out on a run or going on the track, it's entirely different shoe gear than what we're talking about right now. For that, you want something supportive, something with a nice usually a thick heel, thick sole. It's the opposite when it comes to preventing falls, because you want to encourage the proprioception in your feet. You want to be able to feel everything when you're walking to prevent falls. If there's more padding And also you don't want those kinds of slippers that you're slipping right into. If there's something that's going to fall off the feet, or something with too much padding that you can't feel the bottom of the floor that you're going down, there's nothing to help you really.
Dr. Irwin, do you have any recommendation brand where the name of that shoe or
Oh, no companies have specifically given us any money yet to recommend. But what we're looking for is something that's very minimalistic, something that doesn't have, which is actually kind of
a walking shoe.
Actually, that you almost like in a counterintuitive way. You want to reduce the amount of padding. When she said the word proprioception, I want to make sure I demonstrate exactly what that means. Proprioception is it's like a sixth sense, but we have like 12, 11, 10 senses. One of them is proprioception. It's the ability to know where your body is in space without your eyes. So I can put my hand anywhere here, and I can put my finger right in the center of my palm. It doesn't matter. I don't need to look at it. When you have neuropathy or polypharmacy for some medications, you don't know where your feet are in space. Your brain is relying on visual indications to maintain your balance. And that's why maybe a nightlight would be another intervention to have for your mom or dad, especially if they have neuropathy and loss of proprioceptive abilities in their lower extremities. When we do assess these patients and we do find out that they are at risk for falls, on top of just having the discussion with them, and I like to always bring up this one study about the Tai Chi. Did we talk about this yet? So the Tai Chi study is where it's a landmark study in this particular aspect. They took about 100 people, and they split them up into two groups, and they followed them for a number of years in an old folks home. And for half the group, they were the control, and the other half, they gave Tai Chi exercises a certain amount of times a week. And what they found was, over the course of years, the ones who did Tai Chi multiple times a week were less likely to fall, less likely to get hurt when they fall, and less likely to die after a fall. And the conclusion of the paper wasn't that, everybody should do Tai Chi in the park, and look like that kind of guy. No, it's movement-based exercises are very important for the brain-muscle connections, brain balance connections. And that's what we do. That's our intervention. So I referred all my patients. I refer to Dr. June Reyes right here because he's so good. So maybe you can tell us some of the treatment exercises and things you do.
Combination of strengthening the lower extremity, strengthening the ankle muscles, the knee muscles, the hip muscles. One of my favorite exercises are the sit to stand exercise. The sit to stand exercise, very important because when you do this, you're strengthening your ankle, you're strengthening your quadricep muscles, and you can improve your strength and your balance. So I would ask the patients to do this every day, 3 sets of 10. So you're gonna put your hands just like this, and then of course, proper body mechanics, upright posture, so they can do move forward, and then they can just push up with their legs, and then just do this. This is a basic exercise, very important. A lot of patients can do this, and by just doing this 3 sets of 10, show that it's going to help prevent falling.
Take your upper body out of it. It's harder to do some of these exercises when you can't stabilize with your upper body. So make sure that you're spotting your mom or dad if you're actually going to coach your mom or dad to do this. Foot flat on the ground, lean forward. You rock into it. Let your own momentum pull you up. 10 times, 3 sets. Every day, mom. Every day you got to do this. I don't want to hear any excuses. And you make sure mom does that. Otherwise, mom's going to break her hip, and everybody's going to be mad at you because you didn't do it.
Another one is the heel raises. Make sure you stand. So we're holding a sturdy object. We're gonna do heel raises up and down. You can do as much as you can. Make sure you do it slowly like this, and then up and down. And you can also close your eyes while you're doing this. So you're using your vestibular system to improve patients' condition by closing the eyes. That's going to challenge your proprioception, your sensory component of the lower extremity. So those are the 2 exercises that we do with the patients. Yeah.
That's perfect. That's amazing. That's so good. I also noticed that you have some boxing gear.
Yeah.
What is going on with that?
We have this. So Dr. Kilfoil, you can wear this, and then Dr. Irwin can show.
Finally.
Dr. Irwin, you can
You're supposed to touch the mitts, okay?
Yeah. So you're gonna stand.
Yeah.
And Dr. Irwin is going to be doing the punching. Yeah. So this is a very good exercise. This is what we call dynamic exercise. So what's gonna happen is you're gonna punch this, so as you can also move, punch, and then use the right. Yeah. So you can also you can also move side to side. Dr. Irwin. Yeah. Yes, that's it. While punching.
Okay.
So as you can see, this is a challenging exercise. So you're only gonna do this if you're in a safe environment. Maybe someone is gonna be right here behind her, or we can use this this one. So we can use a harness, and then that's gonna help decrease the risk of falling. But you can continue doing the punching. It's actually a very good exercise, dynamic exercises, and you can do up and down, and you can do visual right there, uppercut. Yeah, uppercut. Yeah, right there.
Yeah,
so
that's it.
yeah, you see, as you can see, it's actually good challenging exercise.
Yeah.
Look at that. So with all these exercises, it should be done 3 to 5 times a week, and it should be 30 to 45 minutes of exercise.
Sure.
So another exercise for patients with balance problem, very important to do this, is you stand in the corner, make sure you're in the corner, and then you're going to do standing with eyes closed. So you're going to put your arms across the chest, and then you can copy me, Dr. Irwin, Dr. Kilfoil.
Sure.
So put your feet together, put your hands across the chest with your eyes closed in the corner. So you can start doing head turns side to side, and you can do this 3 sets of 10, up and down, 3 sets of 10. All right, so that's a very good exercise to challenge patients with balance problem. It's going to help minimize the risk of falling. Number 2 exercise is you're going to do some head movements in rotation, just like this. And this is very hard. It may trigger some dizziness, but if you can do this for 30 seconds without swaying, that's a great exercise. It will challenge the patient. Another one is doing marching in place, just like that, with eyes closed. And this is a very challenging exercise because you're combining walking and with your eyes closed, just like this. And you can do this for 30 seconds. And that's it. Those are the basic exercises that's going to help you minimize the risk of falling, and it's going to help all your problem with your balance situation.
Very
balance
good.
problem.
Well, Dr. Reyes, thank you so much for hanging out. Just wanted, can you tell us more about your YouTube channel?
Yes. If you're new to our channel, you can also subscribe on my YouTube channel, Dr. Jun Reyes, PT.
Very good.
Yeah.
Awesome, man. Thank you very much. So make sure you tune in, Dr. June Reyes. Look him up. Awesome channel. And thanks for hanging out.